Started.
Hey, hi, how are you?
Good, how are you?
My name's Nurse Erin. I'll be taking some of your vital signs today.
Okay.
Hold on. So first what we would do, I would take the patient's history using the OPQRSTU,
An acronym.
an acronym, thank you. That's the word. First I would check the onset and find out what brought her here today. Then I would use P, what provoked and made this happen, possibly like what she thinks it is. Q, the quality, what makes it better and worse, I believe. And R, which is the region and which area it is most a problem. The S, which would be the severity of it all, and on a scale of 1 to 10, like 0 being no pain, and 10 being the worst pain, like close to death. And then the T, which is the time, like what time of day this usually happens, and U is what do you think it is. The next thing I would do would be to take the weight, and using an upright scale, I would bring her over. She'd stand, and I would make sure the balance scale is equal, and that would give us an accurate reading. And then the next, I would take the height, which would be I'd have her against the pole, and then I would use a measuring ruler, I believe. Yeah, that's it. And I would use that to to check and see how tall she really is, and I would say it in inches first, and then actual feet. And then I would always, of course, wash my hands to make sure that the patient doesn't get any infections, because one of the major infections a patient can get would be in the hospital, such as nosocomial infection. And when you wash your hands, you would first put some water on it, and then soap, and then wash it make sure you get everywhere, and sing 2 choruses of Happy Birthday. Then you would also take the patient's temperature, and you do the normal range is 96 to 99. And that if it's anything above, she should obviously go to the hospital and get that checked out because she's very sick. Okay. When you take the pulse of a patient, you would also check. Did you do this? Yeah. Okay. What I would do would be I would check this, like this. I'd feel for the patient's rate, rhythm, force, and elasticity. And I would do this for around 30 seconds, which is the NCLEX question perfect answer, but really it would be like 15 seconds. Good to know. And when taking this, the rate should be about 60 to 100 beats per minute. The rhythm should be a good steady, like love dove sound almost. What do you feel like? The force would be measured in 0, 1, 2, and 3. 0 is weak, and you would check it. You would go by either saying the pulse is weak or thready, or strong or pounding. And the elasticity, like a vein is something like this, which makes it easier for the blood to flow through. If it was hard, that would give the blood less of a way of getting around the system and making its way. And then you would also check the patient's respirations and breathing this way, but you wouldn't tell them, so you would really take their pulse for around a minute. They think that, but you actually are taking their respirations as well, because if you tell them you're watching them breathe, they might change it the way, and it might become a little more tense. Next, I would take the blood pressure. Okay. I would have the patient sitting upright with her legs uncrossed, and her hand facing supine or up like this, so her brachial artery is showing.
Remember my sleeve mat?
Yeah. The gold standard for blood pressure is 120 over 80, and the cuff should be about 40% of the patient's arm.
You can come in if you want. It's fine.
Okay. To take her blood pressure, I'd listen for the brachial pulse, and then I would start pumping.
I always do that.
This is a blooper video.
It's fun.
You go up until the pulse is obliterated, and then you go about 30 numbers higher than that, and then you steadily let it out to take the patient's blood pressure. Her blood pressure was 120 over 75, which is pretty good as long as it's not high. When it starts getting into a lot higher, that's very bad, and the patient could have prehypertension or hypertension. And you also have to make sure you obliterate the pulse first, which is you don't hear it anymore when you start pumping the cuff, and then you go about 30 numbers ahead of that, and then you slowly let down. The systolic, or systolic over diastolic, and the systolic you are letting the blood's actually leaving the artery and going through, and the diastolic is the artery the blood resting, the heart resting rate, and that's what you test for mainly. And that's it for vital signs.
Okay. You just have to stop.